In this video, you are going to learn about childhood disintegrative disorder. Childhood disintegrative disorder is a rare condition characterized by late onset, which means 3 years or before of age, of developmental delays or severe and sudden reversals in language, social function, and motor skills. Children with childhood disintegrative disorder have at least 2 years of normal development in all areas. These areas could include language understanding, speech, skill in the use of large and small muscles, and social development. After this period of normal growth, the child begins to lose the skills he or she has acquired. This loss usually takes place between ages 3 and 4, but it can happen anytime up to age 10. It is a complex disorder that affects many different areas of the child's development. It is grouped with the pervasive developmental disorders, which falls under the umbrella term of autism spectrum disorders. This condition is very rare. The prevalence of CDD is 1 in 100,000 boys. The ratio of boys to girls is estimated to be 8 boys to 1 girl. The following case study is about a girl named Hannah who lives in Queens, New York, who presented with normal development till age 5, followed by deterioration in previously acquired language, social, and motor skills. Hannah's parents are concerned about their 7-year-old daughter's change in behavior and development. They discussed with their pediatrician Hannah's irritable behavior and communication problems. They explained the following to the doctor to provide him with a background of their daughter up until their growing concerns. Hannah was born at full term and had no complications after birth, and she attained age-appropriate motor and language milestones till age 5. She was toilet trained and was able to hold her own bowels and bladder. In addition, she used to take a bath all by herself with soap and water under supervision. Hannah also attended school where she learned to recite poems and stories. At age 4, she developed a severe upper respiratory tract infection. She suffered with a fever and cough for 6 months. The parents were instructed to use medications for 1 month with regular follow-ups, but they could not do so due to financial restraint at the time. From then on, Hannah began to get severe attacks of fever and was only treated by an unqualified health worker. Due to her condition, she stopped going to school and started to lose all the communicative milestones she acquired, such as talking sentences and calling her family members by name. Instead of playing with her friends like she used to enjoy, she would sit all day self-absorbed in play and showed increased irritability and anger, where she would hit or bite anyone who disturbed her. At home, she stopped asking for food and would only cry if she was hungry. She also stopped practicing personal hygiene and would pick up bits of sticks and stones from the floor and put them in her mouth. She did not sleep at night and would cry for no apparent reason. She even lost the toilet training she previously acquired and started to pass stools and urine in her clothes. Based on the following information, the pediatrician sent Hannah to the psychiatric division of Mount Sinai, located in Astoria, Queens. She was admitted as a patient and they completed all medical tests, such as a complete blood picture, liver test, urine test, and more, to rule out different medical issues that could be the cause of this reversal in the different areas of development. All investigations came back normal. However, the CT scan showed marked reduction of brain volume, and the IQ test revealed that she had an IQ of 37, which is classified as a moderate intellectual disability. Based on this information and the child's loss or regression of receptive language skills, expressive skills, social skills, playing with peers, and bowel or bladder control, after having an apparent normal development for at least the first 2 years after birth, the psychiatrist diagnosed her with CDD. Based on this diagnosis, Hannah was prescribed risperidone, which is a medication that belongs to a class of drugs called atypical antipsychotics. Risperidone is used to treat certain mental mood disorders such as irritability with autistic disorder. Hannah began to take 1 milligram a day, and over the next 3 weeks she improved. The symptoms of irritability and anger have reduced, and she also started to sleep normally. In addition, her motor coordination improved, and she was able to feed herself, which she was previously not able to do. The following checkups over the next 6 months, Hannah has shown improvement in communication in the form of naming objects, and her social interaction has improved as she started to play with other children at her house. She has been referred to a center where she is being given special training to improve her cognitive abilities and receive speech and language therapy along with social skills development. She is scheduled for a clinical interview every 2 months with the stated medication and training to assess her improvement. Up to this point in time, 3 follow-up visits have taken place, and substantial improvement was found in the areas of language, communication, social skills, and motor skills. The case study on Hannah presents symptoms that a child can possibly show, which may lead to the diagnosis of childhood disintegrative disorder. To recap, CDD is a rare condition characterized by late onset, which is 3 years or more of age, of development delays or severe and sudden reversals in language, social function, and motor skills. CDZ is most commonly diagnosed when the parents of the affected child consult the pediatrician about the child's loss of previously acquired skills. The treatment for CDD is very similar to autism, and the emphasis falls on early and intense educational interventions. Most treatment is behavior based and highly structured. Educating the parents is also emphasized. Speech and language therapy, occupational therapy, social skills development, and sensory integration therapy may all be used according to the needs of the individual child. Like you saw in this case study, the acquired skills that a child loses due to an unknown cause can be improved with the right treatment. Unfortunately, there is no cure for this disorder.